We've all heard about using GPS in our cars or using GPS on our phones, but have you ever heard about using GPS for a surgery? Well, I'm excited because today we're going to be learning all about a new technology. We're at St. Francis Hospital and a couple doctors are going to be teaching us about this new technology. So it's time to get our scrubs on.
Dr. Girardi and Dr. Thayer are using a new GPS device. It's called the iLogic system by Superdimension to identify tumors in the area of the lungs they couldn't reach before. They explained to me how this device is saving lives.
This is a regular bronchoscope, one we've used for many years. The visualization is carried through the fiber optic cables into the TV screen, which we then watch it on the TV screen.
Is that where the camera is?
Yes, that's correct. This one is much smaller, is part of our GPS system, and it's steerable, so we can move it back and forth and direct it in the direction that we want it to move. So this one goes inside this one, so then we can direct it outward into the lung and steer it.
Wow, so it comes out the end of the camera.
That's correct, and we can steer it in whatever direction we choose, and we're following the pre-planned pathway that Dr. Girardi previously mentioned.
Is it kind of like your car GPS or your phone GPS?
Yes, it is. This technology provides us with a three-dimensional GPS, if you will, within the lung using a computer and a high-resolution CAT scan with an electromagnetic field which we place over the patient's chest and navigate directly to a spot in the lung which we've identified may be a tumor.
It looks like a video game.
It is. This is a screen that we would see in the operating room. Sometimes we can do some additional slices, but you have a CAT scan imaging and a three-dimensional program of the bronchial tree. And this is one of the secrets to the device, where it gives us a very specific guidance to tiny airways which we're not able to see. And we can follow the guidance to some degree to help us get to where we need to be in the lung. This is an overall sort of three-dimensional view of the bronchial tree. If you can imagine the lungs on either side, this is the windpipe, a target lesion which was identified, and the purple pathway is our guidance pathway that's been programmed to get us to the area in question.
It's very hard to cure lung cancer, so the earlier we can get to these patients, the better chance we have.
Technology is impressive, but it's even more impressive when it's used to save lives. And St. Francis Hospital prides themselves on staying up with the newest technology. For more information, visit their website.